More than 40% of nurses score in the high range for job-related burnout, and more than 1 in 5 nurses plan to leave their job within the next year. Nurses are essential to the well-being of our country, and we are facing an extreme shortage. Since the COVID-19 pandemic began, the insufficiency of nurses has continued to get worse, and a main cause of that is job burnout. Long hours, high stress levels, and high nurse-to-patient ratios lead to nurses feeling burnt out, resulting in them having to leave their jobs. To begin, let's define burnout. There is not one specific definition to explain the psychological feeling of being burnt out. The Maslow Burnout Inventory describes job burnout as a syndrome of emotional exhaustion, depersonalization, and reduced personal accomplishment. Burnout is also associated with feelings of psychological distress and alcohol and drug abuse. When faced with these conditions, nurses are likely to perform poorly, which can result in errors or patient deaths. Nurses are becoming drained from their jobs, and patients are being put at risk. This begs the question, how does burnout affect patient care, and how can we aim to prevent it from happening? One main stressor that leads to burnout is the amount of time that nurses spend at work. Registered nurses are typically work an average of 3 to 4 12-hour shifts per week, totaling around 36 to 40 hours. However, more than a third of nurses sampled work 6 or more days in a row at least once in the last 6 months, according to the American Journal of Nursing. During these long shifts, nurses are tasked with intense duties to help save the lives of patients. It takes a lot of time and consciousness to ensure that each patient is well attended to and gets the attention and care they need. After a long, tiring shift, nurses need time to recover and rest to avoid overexertion. However, many nurses work extreme hours, increasing the risk of them getting burnt out. Nursing is a naturally stressful job. Job stress causes health disorders, reduced creativity, decreased personal satisfaction, and depressed feelings, according to BioMed Central Nursing. It takes a lot of strength, emotional stability, and resilience to be a nurse. The amount of pressure that is placed on nurses can lead them to getting burnt out. There is no way to eliminate stress for nurses, but there are ways to reduce it, such as limiting hours, lessening patient ratios, and ensuring full staffing. One of the main factors that causes nurse burnout is an overwhelmingly high nurse-to-patient ratio. According to registered nurse Trista Parsons, at her hospital it used to be typical to have about 6 to 7 patients on the medical surgical floor. However, it became the new normal to have anywhere from 10 to 12 patients at a time, causing an intense amount of strain and pressure. This can take a heavy toll on both nurses' mental and physical health, and it puts patients at risk for medical errors. By placing mandates that regulate patient ratios, patients and nurses would be safer. The high nurse-to-patient ratio needs to be managed to decrease these issues and increase the well-being of patients and nurses. For those who do not resign and continue to work through burnout, their jobs are done half-heartedly. In a study done at Marshall University, it was found that increased emotional exhaustion in nurses was related to lower patient satisfaction. Patients can tell when their nurses are burnt out and not doing their best. In another study done by Marshall University, 9.6% of RNs in their sample had a contaminated needle stick or serious injury, and 15.1% provided the wrong treatment or dose to their patients. Nurses are being put under more pressure, making them prone to medical errors. This is a threat to patient safety. When you are sick or injured and go to the hospital, you are supposed to trust your caretakers and shouldn't have to worry about their ability to care for you. Burnout negatively affects patient care. There needs to be something done to protect the nurses and patients of our country. Right now, we are facing a concerning nurse shortage. Nurses across the country are becoming burnt out and quitting their jobs, leaving patients in the dust. Nurses are crucial to the survival of our world, and it is imperative for change to occur to prevent them from getting burnt out. You can take action by talking to your local government and hospitals to help solve this problem. Look at the links in the description